IPLs are jack of all trades, master of none. And lasers are master of one.
Or two, maybe.
Or two, maybe.
Yeah.
So they're more effective because they're more specific.
Yeah. Hi, everybody out there in internet land.
Welcome to Skin Deep with Dr. Amy Miller.
That's me. I'm Dr. Miller. And as you can tell, that's not Megan. This is Andrea, our laser tech extraordinaire and medical assistant at St. Louis Skin Solutions. And we decided to talk about today that was very bad English. We decided that we wanted to talk today about laser hair removal. Laser hair removal is fabulous in my opinion.
Reduction.
Reduction.
Nothing is permanent.
This is true. Good point. Good point. Laser hair reduction. I love it. I love not shaving. I haven't shaved my legs for 15 years. It doesn't look too bad, does it?
No, I'd say it looks pretty good.
Yeah, nice. Feel how smooth it is.
It looks good, Dr. Miller.
No, don't report me for harassment.
I think we've known each other long enough that we don't have to worry about that.
My boss made me touch her legs. Ew. Well, no, let's talk laser hair removal. So, it's a popular treatment here at St. Louis Skin Solutions.
It is.
You say?
Yep.
Yeah.
It's probably, I also do a lot of our medical weight loss, but I'd say as the years have gone by, I've transitioned more to doing more laser hair than medical weight loss. I'd say it's probably about 60% of what I do in the office.
Okay. All right. So laser, for those of you who don't know, is an acronym, and it stands for light amplification through the stimulated emission of radiation. The first time I heard that, I thought it was something naughty, but it's not. It's kind of boring. It's all physics.
Yes.
But basically, we're using light energy to target hair follicles and, for lack of a better term, cook them.
Right.
Right?
Mm-hmm.
Yeah. So tell me how it works.
So the light energy in the laser is attracted to the melanin in the hair follicle. So laser hair reduction with the laser that we use is only effective on hair that has melanin in it. So it won't work on white hair, red hair, blonde hair, silver hair. The hair has to be dark enough for the laser to be able to distinguish what it is.
Right. And how does the laser know not to get the pigment in the skin?
It's attracted specifically to the chromophore hair, the pigment in the hair follicle. It is able to distinguish between the pigment in skin and in hair, which is effective.
Yep.
In that way.
And sometimes to the different types of laser you use, penetrate to different depths in the skin.
Right.
So if there's a lot of pigment in the skin, if somebody's very tan or a type 5 or 6 skin type, a dark skin, what would you do in that case?
There's a lot of different wavelengths that you can use to treat hair with lasers. The 755 is used for non-melanated patients, so people of like European descent, white people. And then you'd use the 1064, which is an ND-YAG, and that is safe for treatment of hair in melanated skin types. So people with black skin, brown skin, all that good stuff.
So the 1064, since it's a longer wavelength, will penetrate a little deeper in the skin before it starts looking for its target for the melanin. Yes. Okay. And then there's even a third laser that we use here.
Yes, we have a diode laser that's 840 and an 810 wavelength, which we use over at our secondary location in Darden Prairie, the Diogo.
Yeah. So when we talk about wavelengths, it's helpful to think about what's called the electromagnetic spectrum, and I'm getting really nerdy now, but visible light, so light that comes from the sun, is, UV light, 200 to 400 nanometers, and then the color of the rainbows, like blue, green, those are all visible light. I know we have a green light laser, which is great for vascular issues, but that's 532. Okay. So as we get to the 810s and the 1064, they're not visible by the human eye, are they? No. More in the infrared spectrum. Yeah. Okay. So I know it's frustrating because people always ask, well, why do I need so many treatments? So how many treatments do people need, and how do we space them, and whatnot?
So we usually recommend a treatment of between 6 and 8 to start. Some people may need on the lower end closer to 6. Some people need upwards of 10 to 12. It just depends on the texture of your hair and if we can catch it in the right hair cycle. So the hair grows in 3 phases, and laser is going to be the most effective if you can catch it in the anagen phase, which is the active growth phase. We do want to catch the hair in every phase of its hair growth, but by catching it when it's in its anagen phase, you're reminding the hair to stop growing, to not regrow again, because as it's growing, you're destroying it. So it's being reminded over and over again not to regrow.
And I remember learning about when the anagen phase, that's when the bulb is the biggest and beefiest. So that's when it's the biggest target for the laser.
Right.
So the laser can maybe see the hair in the resting phase, but it's not going to be as effective at really destroying the follicle.
And it can be tricky. We time treatments usually between 4 and 6 weeks apart because every single hair on your body grows at a different phase. No 2 hairs are growing at exactly the same rate. And so by spacing treatments apart, we have a reasonable amount of certainty that we can hit every hair in every phase at some point.
At some point, right. So in order to get it all done in 1 or 2 treatments, we'd have to be a miracle. All the hair, every hair would have to be in that anagen phase at the exact same time.
Exactly.
Which is crazy.
Yeah.
It doesn't work that way.
It never happens.
Human body doesn't work that way. No. Okay. What other questions do you get about laser hair removal?
I get a lot of questions about if it's painful.
Yeah.
The laser that I use most frequently here is the Clarity 2. It is equipped with cryogen cooling, so it's actually super, super comfortable. It feels like sort of a spurt of cold. Some people say that it feels wet when it splashes because the cryogen can almost splash. But it's cool more than anything. Afterwards, it can be a little hot. It can sting a little bit. But I have almost nobody really complain after we've been in there and we've started the series complain that it is truly painful in the way that the Cutera or the Light Shear were.
Yeah, the Light Shear was painful.
The Light Shear was bad. I remember.
That's what I did.
I think I was 17, and somebody here was training on the Light Shear, and they did my underarms, and I was like, I'm never doing that again.
Yeah,
that was horrible.
It's always. But hey, if you want it gone.
Yes, and the Light Shear is super effective. It was a great laser, but it
was painful.
Yes.
There's no two ways about it.
Yes.
Yeah.
But it's a really comfortable laser for all skin, and it's effective for all skin types because it has the 755 nanometer wavelength and the 1064 nanometer wavelength.
And that's always nice too, because if you do a bunch of treatments with one wavelength and maybe stop responding, it's nice to be able to throw another wavelength at the patient.
Right.
Just mix it up a little bit.
Yes.
You don't want the hairs to get resistance. I think of it like antibiotic resistance almost. So. Okay. What else? What other questions do people ask? Why is it reduction and not removal?
Because, for lack of a better phrase, it's not permanent. The hair, you can stop it from growing for so long, but hair is resilient, and the only way to really destroy it is through electrolysis, thermolysis, which is a separate.
Well, and I think you can kill some of those terminal hairs.
Yes.
But you're never going to get the vellus hairs.
Right.
Those are the baby fine hairs because they're too light for the laser to see.
Right.
And over time, those vellus hairs can transform into terminal hairs.
Yeah.
So you can never, say 100%. It's gone. But what I've noticed with mine, because it's been a long time, and I did the Light Shear. It was not fun, but I was motivated. But when I take a really close look and put my magnifier on, I can see hairs, but I don't feel them because the ones that are left are so damaged. So they're just like wimpy hairs trying to grow. So, so in that case, I really liked my results, and I have had long-term results. So,
I have plenty of patients that I'll see for a series of 6, 8, 10 treatments, and then I see them maybe once a year to sort of clean it up.
Right. And hormones are always the wild card.
Yes, a lot of the time when I have, and also a lot of patients that I see, particularly female patients, there's a lot of them who come to us because they've been diagnosed elsewhere with PCOS, polycystic ovarian syndrome, which one of the side effects is a lot of the time unwanted hair growth on the face.
Right.
And because with something like PCOS, we don't know a whole lot about it, we're it's hard to say exactly how many treatments something like that will take because their hormones are already skewed in a way that's making hair grow where it's not supposed to. So even hitting it with a laser, it does work, but it might take more treatments, more sessions, more time.
Yeah, and in those cases, sometimes I like to refer to controlling it rather than curing it. We're not going to completely get rid of it, but you may just have to come in every once in a while just for the treatments.
Yeah.
Okay, so what else? What are some of the side effects?
So side effects from the laser, a lot of the time you can have like mild itching, stinging, tingling at the site that usually dissipates within an hour after treatment. Clinical endpoints, perifollicular edema, which is the edema, swelling surrounding the follicle. It looks a lot like hives. It can be itchy, it can be red, it can be irritated. I haven't seen it last longer than 24 hours. Okay. It's possible that it can, but that's very rare.
Okay. And what are some adverse outcomes?
There's one patient that we've been seeing for a very long time who has paradoxical hair growth, where the laser did the opposite of what it was supposed to do, which I think we in this office only have one documented case of paradoxical hair regrowth.
Yeah, I remember reading about that possibility 5 or 10 years ago because we thought, there's no way it could cause hair to grow. We're killing hair. But it actually has been documented, and mostly in type 5 skin types for some reason. We don't know why. But that is a possibility. And then the other,
the other is there's a possibility to blister the skin if it's not cleaned off properly. That you can cause burning if your settings are wrong, if you use the wrong wavelength.
Right. You can definitely
if the hair's too long and you burn the hair.
Yeah. Why do we like lasers as opposed to IPLs in this office?
Lasers are, you used a really good phrase the other day that I'm going to try to remember when we talked about this yesterday. IPLs are, what is the...
Jack of all trades.
Jack of all trades, master of none. Whereas lasers, I couldn't think of jack of all trades. I was like, effective at all trades? And lasers are master of one.
Or two, maybe.
Yeah. So they're more effective because they're more specific.
Yeah. And they're such a narrow wavelength of energy and of light, and we can really crank the energy up on that. And with IPLs,
you're really targeting one specific chromophore.
Right. And with IPLs, the intense pulse light is basically, you think of it as a flashlight, and you put different filters in front of that to get your particular wavelength. So it's weaker. You can't crank it all the way up because you'll overwhelm the filter.
Right.
So it's nice because you can do a lot of things, but you can't do anything really, really, really well.
Yeah.
So for people who are not low threshold, but have easy to treat issues, whether it's nice dark coarse hair or deep dark sunspots or whatnot, the IPL can be useful. But since we have lasers here, we see all the people who failed IPL. So I don't use IPL for laser hair removal. I won't use IPL for hair removal.
I've only ever used lasers since I've been in this office. So
you've been indoctrinated into the into the fold. But if you have had laser hair removal in the past, I urge you to find out what was used, because 80% of the time when I asked a patient that, they go back and they come back and tell me it was an IPL. The thing with an IPL is it's a lot less expensive.
Yeah.
So a lot of times, you know, especially people starting out, that's a smaller investment that can do a lot of things. So it's very palatable for a business owner. I wanted to get the best results I could, so I foolishly went in debt. But that's a whole nother podcast that we can go into at a different time.
Yes.
So anywho, we do have an IPL that we use for acne, which I like because it works very nicely and hard to overwhelm the skin, hard to burn the skin with it. So have you used that?
Yeah, on one of our front desk girls. She and I, when we first got the IPL in, she and I played around with that, and then in conjunction with another device that we got at the same time.
Yep.
And I feel like it was helpful for her because she was like very red and inflamed, and it helped to bring the inflammation down.
Yep. Okay. Anything else that people should know about laser hair removal?
It's not scary. It really doesn't hurt that bad.
Or laser hair reduction, my bad.
That's okay. I promise I won't hurt you in there. I'm really nice.
And we often do test spots too.
We do as often as possible. I will do a test spot for a patient when they come in, just to make sure that you don't have any true reactions to the device, to make sure that it's comfortable. And if you hate it, you don't
have to
do
it.
Yeah,
you don't
but
have to
it's
do
really
it.
it's a very, very almost painless process. It's very comfortable.
It's come a long way.
It's very effective.
Okay. Well, great. If you have any further questions about laser hair reduction or want to know more, feel free to give us a call at St. Louis Skin Solutions.
I'm here every day.
What's our number?
314-394-3915.
Okay. We just recently changed phone number, so
Like a year ago.
I don't have it. Well, okay. That's recent. I'm an old lady. That's recent for me. So, signing off, I'm Dr. Miller.
And I'm Andrea.
Thanks for watching.